If you've ever been in search for an aesthetic injector and have wondered what all those acronyms behind their names mean, whether it's RN, NP, PA, MD, board certified, not board certified, aesthetic physician, cosmetic dermatologist, then I hope to answer all of those questions in this video. My name is Dr. Anya Weissman. Welcome to my YouTube channel where we talk about skincare, in-office, and aesthetic procedures. If you like this type of content, please subscribe to my channel, give this video a thumbs up, and I would love to hear from you, so feel free to leave me a comment. Okay, so first question. What is a board certified physician? What does board certified mean? And does your provider have to be board certified? A physician becomes board certified after they complete their training and take an exam at the end of that training, where they choose dermatology, pediatrics, internal medicine, radiology, surgery. At the end of that residency, they take an exam. So in my opinion, any doctor you go to should be board certified. It is sort of like the minimal bar for saying, I completed my training and I passed the exam. After that level of training is where physicians go on to specialize in whatever field interests them as a subspecialty. So you might finish a residency in internal medicine and then do a fellowship in cardiology, nephrology, rheumatology, infectious diseases. Dermatologists also have options in the types of fellowships that they do. And usually that second specialty doesn't have an exam that follows. Some do, but most don't. So now let's talk a little bit more specifically about dermatology. Dermatologists are physicians that focus on the mucous membranes, the skin, hair, nails, and certain sexually transmitted diseases. Now, within that, when we talk about the skin, there are also more categories. Infections like warts, acne, autoimmune disease, skin cancer, all encompasses dermatology. So a board certified dermatologist is someone who completed 1 year of internal medicine or transitional medicine, so just general medicine, followed by 3 years of dermatology training, and then took their exam that encompassed all of dermatology. Now, part of the residency program in dermatology is going to be cosmetic dermatology or cosmetic medicine, along with all the other rotations that they go through, the cancer, the autoimmune disease, acne, etc., etc. So now that they're trained and board certified, they choose what they want to specialize in or not. You could just be a general dermatologist, general internist, general radiologist, or you can specialize. They could choose cosmetic dermatology, dermatopathology. They could choose a surgical fellowship where they focus on oncology, cancers, different types of skin surgeries. And cosmetic dermatology is a 1-year fellowship where they get trained on all the injectables, all the aesthetic procedures, laser procedures. And at the end of that, they are very well versed in aesthetic medicine. So it is possible for someone to be a board certified dermatologist with a fellowship in, say, pediatric dermatology or dermatopathology and have nothing to do with cosmetics other than the basic rotations they did in their residency program. Now let's move out of the dermatology sphere and talk about RNs, NPs, PAs. An RN, as most of you know, is a registered nurse, and that is someone who either has a bachelor's degree or may not have a bachelor's degree. An NP is a nurse practitioner. So this is now someone who has a bachelor's degree in nursing and then goes on to do a master's, for example, or a PhD to become a nurse practitioner. And the highest level of education a nurse practitioner can get is a doctor of nursing practice, a DNP. A PA, on the other hand, is a physician assistant, and these are people who have a bachelor's degree with certain prerequisites in medical and biological sciences, and then they enter a PA program which lasts approximately 27 months and also has a clinical component. Now, on top of all this, there are fellowships for nurse practitioners and physician assistants in dermatology so that they could further expand their knowledge of dermatology, which doesn't have to mean that that is cosmetic dermatology, but general diseases of the skin. Now we get into aesthetic medicine. Aesthetic medicine and cosmetic dermatology are actually the same thing. The main difference is that cosmetic dermatology is the term used by dermatologists because that is their background, and aesthetic medicine is the term that describes the practice but is practiced by physicians who are not dermatologists. Now, originally, aesthetic medicine was really born from dermatologists and plastic surgeons, and now it's really expanded into a really broad umbrella of not only physicians but physician assistants, nurse practitioners, and also nurses. And here is where we get to the tricky part, the question of who's the best educated to provide these services, and how do you figure out what is the best provider to go to. Starting with the dermatologists, I would say they have by far the greatest advantage in training in aesthetic medicine, because after their residency, they can choose a program which is cosmetic medicine, cosmetic dermatology, laser surgery, and they have 1 year of supervised training as they learn and develop and perfect the skills in aesthetic medicine. So that straight off the bat is a great education. Doctors coming from various other backgrounds don't have the luxury of entering these fellowship programs. However, they can choose world-renowned injectors, world-renowned dermatologists and surgeons, and learn from them. So in essence, they put together their specialty education. I would say in general, physician assistants, nurse practitioners, and nurses, and non-dermatological doctors curate their own cosmetic dermatology education. It can be as good as they make it, or as simple and basic and adequate as they invest in it. If someone has a passion for this field, they tend to invest a lot of money every year in conferences, courses, and furthering their education. And they're always on the forefront of the newest techniques and the latest and the greatest, learning from the masters in aesthetics and world experts. And if these individuals have an innate talent for manual dexterity and an aesthetic eye, they themselves become experts no matter what their background. So it takes several factors. One is the education, one is your artistic aesthetic eye, and another one is your actual manual dexterity and how good you are with your hands. Just like for a surgeon, the best surgeons are not only knowledgeable, but they're also very good with their hands. I will say that plastic surgeons tend to hire either physician assistants, nurses, or nurse practitioners because their primary passion is actually surgery. But in order to have a complete aesthetic practice, they will perform the surgeries and have someone else do the injections. So that's the most common surgical setup, although many surgeons do injectables and simple in-office procedures, and that really just depends on the scope of their interests and their passions. Unfortunately, this industry is not regulated, and sometimes as little as a weekend course will get someone off and injecting. In addition to that, there are counterfeit products, counterfeit fillers, Botox. I've even heard of counterfeit lasers. So it's really important to know who you're going to and to do your research before you go. And I'll give you an example. The most renowned and famous lip injector in the world is a woman named Horne. She is a registered nurse by education, but she is the master of lip injections, and she teaches dermatologists, surgeons, physicians, and everybody else. She is the guru of lip injections. So at that level, those acronyms really fall to the side, and you really look at the artistry that people create, their passion, how much they invest into their education, the results that they produce, and you judge based on that. In general, I would say find people who have a passion for this, because the passion leads to continuous improvement. I think that's really the key. Education is definitely helpful. Background is definitely helpful. And natural skill and talent also, makes a huge difference. Since there are a lot of challenges in finding a good injector, I've put together a little checklist or cheat sheet to help you go through and ask questions or research to find out who might be a good fit for you. So I will link that down below. Feel free to check that out. And if you have any questions, please leave them down below, and I'll see you guys in the next video. Let me share with you my background. So I entered a radiology program which required 1 year of general medicine followed by 4 years of radiology. After that, I took my board exam and I became a board certified radiologist. Then I chose breast imaging as my fellowship, so I specialized and became an expert in breast health and breast cancer. I did that for years. Then I went on and ended up working in emergency radiology for years, where I became an expert at that by virtue of doing it so much. And then I slowly transitioned into aesthetic medicine. So the advantages I carried with me is I had a very good foundation in anatomy, and I also have a very good understanding of ultrasound, which I actually still do till this day and use it in my practice because I find it extremely helpful. When I inject fillers in danger zones, I like to map out where vessels are, at what depth they are, and if they are bisecting the area that I'm going to be injecting. So I find that extremely helpful. It's super fun and really exciting, and I find that everyone I meet has such a passion for this that there is no burnout. Everyone loves what they do. It's really a beautiful field, and I'm so glad that I'm part of it. I love what I do, and I just love growing in this field. It's super fun and amazing.